Dr. J here. Today we're going over vitamin D deficiency, okay? What some of the symptoms are, what causes it, some foods that will help, and then of course supplementation and what to take in, okay? And so let's get started, okay? So studies that are out, the recent studies are showing that 75%, that's a lot, 75% of the people on the 35th parallel, that's us here where we live in Redding, California, so check out where you live, are deficient in vitamin D. That's a bummer, okay? So what are we going to do to offset that, okay? So basically 75% of your friends are vitamin D deficient. So let's look into that here in the United States and on the 35th parallel, which would be Canada, Europe, etc. Check out where you live. Okay, so what are the symptoms of that? So vitamin D deficiency would indicate problems with your immune system. Any disease of the immune system, autoimmune system, you have a potential to be vitamin D deficient, okay? Any problem with an overgrowth of Candida or bacteria overgrowth, likely to be vitamin D deficient. If you struggle with your emotions, like you are up and down with your emotions, or continual depression, any anxiety, so continual depression, any anxiety, you could potentially be vitamin D deficient. Okay, if you struggle with putting on muscle mass, or if you have trouble losing weight, you could potentially be vitamin D deficient. There is an inversion that occurs with weight gain, that vitamin D and BMI are inverse of each other, and so that has to be checked. Okay, so as a chiropractor, I do a lot of blood work for patients to see where their neuromuscular skeletal system is, and so I check on vitamin D. Okay, and so vitamin D, your serum levels run 30 to 100, and me personally, so conventional medicine gives you analysis of 30 to 100 being normal. I like it at 70 to 90 myself, okay? You're not toxic then, and if you're really sick, which would another symptom of having the possibility of vitamin D deficiency would be cardiovascular disease, diabetes, cancer, okay? So that's a correlation there of a potential vitamin D deficiency, okay? So that's why you need to know. The other would be sweet bones and teeth, so it's osteoporosis, osteopenia, another sign that you could potentially be vitamin D deficient. Any type of kidney disorder or hormone imbalance is another correlation or symptom that you could be vitamin D deficient. And so we need to check that. You need to get involved and check that. So what the heck causes a vitamin D deficiency, you ask? Well, sunlight is the biggest need that we have to boost our vitamin D, okay? Sunlight, okay? Yes, okay, so studies in the United States of America, these indicate that 86.9% of our time is spent indoors. Whoa, that is a lot of time. We need to get outdoors. 86.9% of your time and my time, according to the study, is spent indoors. So we need to get out in the sun. Take a walk. Go sit on your front doorstep. Do something to get yourself outside and expose yourself to sunlight, okay? It's the UVB light that penetrates straight through into the dermis of our skin, and there begins to move vitamin D through the liver to then turn it active, to activate it so that it can affect the immune system and your kidneys, okay? So those are the places that it works. The immune system, kidneys, calcium regulation, so our bone strength, okay? So another cause of our vitamin D deficiency is toxins. One example is PBA, which is bisphenol A, okay? It's in our plastic. So foods are packaged a lot in plastic, water in plastic, and so as the plastic heats up and cools down, it can leach the plastic into your water, we'll just say water for now, or food if you're microwaving, I won't go there either. But anyway, that creates the toxin, and therefore it inhibits the vitamin D from being absorbed. Also, get this, here I'm going to mention it as a toxin, but you'll get the picture. High fructose corn syrup. Yeah, I said it. High fructose corn syrup. So if you're consuming a lot of high fructose corn syrup, so you need to read the packaging, what the ingredients are. You also not only need to do that, you need to cross-reference high fructose corn syrup with other names they use these days, okay, to hide it. Anyway, that baby deactivates, inactivates, shuts down the active form of vitamin D. And so you're taking it and then you're sucking down high fructose corn syrup, then you're gonna have a problem with the absorption. Hate to tell you. So there are many other toxins. Those are two that we utilize a lot. So if you need any of those studies, please feel free to ask. I'm happy to share them with you. Okay, so foods, what foods, how am I gonna overcome it? So there are some foods that you can get. So of course, salmon is high in vitamin D. Wild caught salmon, wild caught fish traditionally are high in vitamin D, so you can absorb those and get those and eat those. Any type of eggs, of course, the yolk is high in vitamin D. Let's see, there is a little bit of vitamin D in raw fermented goat milk or yogurt. That would be a very good source, but it's just a little. Some mushrooms also have vitamin D. So those are some choices. I eat a lot of fish, so I'm helped there, and I also supplement. So that takes me to the next choice. So a good supplement is important, okay? So you can get a supplement in tablets, capsules, and liquid. So if you're fighting any type of disease at all, especially digestive health, I recommend the liquid. You put it under your tongue, boom, you're good to go. You don't have to fight absorption. If you can handle a capsule, that would probably be the second way I would do it. Let's see, most people, I recommend 2,000 to 5,000 international units a day, depending on your opportunity for sunlight. So I'll go back and remind you that vitamin D here in the United States is measured from 30 to 100. When it comes in low in the 30s, like I had said before, you want it in between 70 and 90. Okay, that's where I'm comfortable with it. Mine's been as high as 110. I'm still alive, okay? If you're in severe low, then you may need 5,000 international units twice a day for 30 to 60 days just to lift you. But again, you need to have it checked, okay? So you don't just play around with those numbers. Let's find out what it is and where you need to go. So when you do take vitamin D as a supplement, you want to be taking it with a fat, okay? So let's see, a teaspoon of coconut oil, some avocado, let's see what else, almonds, walnuts. Because it's fat soluble, it'll be absorbed faster, okay? Okay, so that's about it. You need to remember that when you have a correct vitamin D levels in the body, your immune system's stronger, your hormones are balanced, your bone strength goes up, and your moods improve, okay? So I hope this helps you. Thank you for allowing me to help you take our next step together towards health. Don't forget to subscribe and click on the bell for reminders. Thank you and have a blessed day.